From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Welcome back, everyone. Today, we're diving into neuroplasticity or brain plasticity, a term that sounds complicated but is absolutely fascinating, and we're here to make it easy to understand. Essentially, neuroplasticity is how our brains can adapt and change over time, and it plays a huge role in managing chronic pain. If you've been struggling with discomfort, this episode could change how you think about recovery. To help us break it all down, we've got Dr. Joe Damiani, a specialist in TMJ, neck, and head pain. He's going to explain how neuroplasticity can do more than just help us cope with pain. It can actually rewire the way our brain processes it. Plus, he'll share actionable tips to help reduce pain and support recovery. Hi, everyone, and welcome to the Care Experts podcast. I am so excited to be sitting down today with jaw and TMJ specialist, Dr. Joe Damiani.
Thank you for having me, Erin.
I'm so excited. Today, we're going to talk a lot about chronic pain and neuroplasticity. I've got 3 quick questions for you.
Let's do it.
All right. What is one fact about pain that a lot of people don't know?
A lot of people don't realize that the body cannot cause pain. The brain produces pain, and the brain is the only thing that can produce pain.
Whoa. Say that again. The body
does not produce pain. The brain produces pain. And what that means is when something happens, if you stub your toe, your body just sends signals up to the brain and says, hey, we have a situation down here. I'm just going to send you signals. What do you want to do with this? And the brain decides if pain is elicited. The brain decides, let's send some pain signals down so that they can take their foot away because we feel that there's danger involved.
Wow. Okay.
Yeah.
We're going to dive into this because I immediately have so many questions.
Right.
How did you get so interested in chronic pain yourself?
Well, so it started for me when I had neck pain and headaches that I figured would just go away in a day, in a week, a month, and it just kept going on. And I started to realize, and I did all of my regular physical therapy stuff and stretching, but it would not go away. And I realized, okay, so there's a bigger piece to this puzzle. And at the same time, I had patients who had been telling me the same thing for years, but I never fully grasped it. It was kind of like, no, like, it'll go away, or that's because, have you seen the neurologist? Maybe it's, I didn't realize the scope of it. And so when it finally happened to me, sometimes that's what it takes.
Always.
And then it kind of sent me on a deep dive. What's
one fun fact about pain or chronic pain that you want everyone who's listening to know?
Hurt does not equal harm. And what that means is, just because something hurts doesn't mean that there are tissues that are injured in your body. In fact, very often with chronic pain, there's pain in the absence of any physical injury.
Let's start with the basics. What is chronic pain versus acute pain?
So acute pain is the pain that occurs immediately after an actual physical injury.
Okay.
That goes away sometimes in a couple of days or a couple of weeks, and that's the end of it. That's acute pain. Chronic pain is pain that lingers for longer periods of time. And if it lasts for longer than 6 months, or in today's definition, we don't use a timeline as much, but more so if it lingers on for longer than it should, just based on data we have about those injuries, we now put it into a bucket of chronic pain.
Okay. So if you know that in general, tennis elbow is going to heal in 6 to 8 weeks, and you're 6 months out and still experiencing pain in the elbow area, we might categorize that as chronic pain?
Exactly.
All right.
Yeah.
So if you have chronic pain, how do you know whether or not it is truly injured still, like that hurt that we were talking about is still there, or whether it's become an issue that is more closely related to neuroplasticity?
So there's always a gray area and a combination between the two, which is something we can also get into, that there have been past philosophies that anytime you have pain, it's always the body, or every time you have pain, it's the nervous system, or it's deep traumas, and that's 100% your pain, and that's what's causing it. Yeah. And so it can get very black and white. But in today's definition, we understand that it's a combination of factors. The body feeds the brain, and the brain feeds the body. So for us to determine if the nervous system is at play here, we do use that original definition I gave you. We know this should have healed already. It has not. And now we know that the mind and the nervous system is playing a role in it.
Okay. What is neuroplasticity? Like, how does neuroplasticity play into chronic pain?
Right. So neuroplasticity, very simply put, is the brain's ability to learn from and adapt to experiences.
Okay.
And more than that, it's not just the actual experience, it's how you interpret the experience. That is really that's really what neuroplasticity is. And I could just give a more practical example.
Please.
Let's say you have two friends.
Yes.
One friend is just a very level-headed person,
Yes.
and another person is a little bit more sensitive and emotional and reacts a little more to things.
That's me.
Okay,
I'm that
so
one.
that's you. Okay. So now let's say that someone forgets to call each of them on their birthday, right? The same experience happened. Didn't get a phone call for my birthday.
Yes.
The level-headed person may say, they're busy, they have a job, they have 2 kids, it's fine. The other person may say, I'm never important to that person, or why did they do that? That was on purpose, I knew it. So now the same experience manifests completely different in their brains.
Right.
And when it comes to chronic pain, it's the same thing. So if you have pain that lingers, and you go through the education of neuroplasticity and go through strategies, that pain can dissipate. Whereas if you instead have the experience of, why isn't this going away? This should be gone by now. Oh my God, I'm so scared. It's the end of the world. The pain worsens.
Yes.
So that's how we tie it all together.
I have done a lot of meditation over the years, and I feel like we call this concept the double arrow. It's where something happens that's painful in our life. It could be a physical injury, or it could be something that's emotionally painful. And it's like that arrow hits you. And then what meaning we make of that situation, or the story that we tell ourselves afterwards, becomes the second arrow that can hit us or not. So if you're experiencing pain in your arm, you are experiencing pain and that's uncomfortable. That's the first arrow.
Right.
And then the second arrow would be the story that you create around this. Why is this happening to me? I always get hurt. It takes me forever to heal.
Yes.
Does that have anything to do with what you're talking about?
Yeah, I think you said it better than I could have. That was perfect.
No.
That's exactly what it is. So it's the experience, the actual event, and then there's the story around it. And that's just one of the ways that chronic pain can manifest. And I know we'll go deeper into it later, but that is one of the ways.
Okay. So are you saying that the story that we create, or that narrative, the thoughts that we have about the injury, that can actually create more pain?
Yes. So if I can just take a moment to explain what I've identified as the 3 different ways that you can have chronic pain. The first one is through emotions, which is exactly what we just said.
Okay.
Now, the next one is about awareness. So just the fact that you are now aware of a part of your body or an area that you never thought about before.
Yes.
And a great example for this is, let's say you're shopping for a new car.
Okay.
Let's say you go to a dealership you hadn't intended to go to, and you see a car that you never really thought about, and you say, this is really nice. I might get this. So you go home to think about it. And on your drive on the way home, what happens? That car, you see it everywhere.
Everywhere.
Right? You see it everywhere. Did everyone buy that car? No, it was always around you. You just never tuned into it. And so just that awareness of that new part of the body that you're constantly like, is it better? Hey, I woke up. Am I in pain? Yeah. I'm going to exercise. Does it hurt? Yeah. And you keep sending those signals. Yes. That awareness also drives it deeper. So we have emotions, we have awareness, and then we have protection. So for this, let's say that there was a time in the past when you turned your head all the way to the side and you injured it and it caused pain.
Yes.
Okay. Your brain says, last time we let this guy turn his head all the way and we warned him with a little pain, but he kept turning and he injured us. So now we don't trust him. So now as soon as he starts to turn that way, let's give him pain so that he doesn't move further and injure us again.
Right. Which is smart on the body's behalf. It is doing the best to protect us from something bad happening.
Yes, absolutely. That's the brain really doesn't care about like how you feel. It just wants to protect you.
Right.
So because of this protection now, you're like, oh my God, every time I turn my head, I'm in pain. I could barely move anymore. There must be something horribly injured in there. Then that sets off the emotions and then it all starts working together. So there's the emotions, there's the simple awareness of it, and then there's your brain trying to protect you. And those are 3 of the very common ways chronic pain can persist.
Okay. So if somebody's experiencing TMJ pain or jaw pain, which we talked about in another episode.
Yep.
And they've seen a professional. At this point, the pain should be gone, but they're still experiencing it. It's
Right.
now been weeks, months, even years, I'm guessing, for some people. In that situation, is neuroplasticity something that can support them in some way?
Absolutely. In fact, any injury, it can support you in some way. And I like to think of it like a figure eight. Think about, you have your physical body on one side and you have the brain and the nervous system on the other, and they're interlooping with each other.
Yes.
If the body itself does have something wrong with it, it sends signals up to the brain, and the brain is going to produce pain.
Okay.
Now, what if the body is fine and it's healed, but the brain is still dysfunctional? It's going to send signals down, and it's going to cause those muscles to tighten up again.
So neuroplasticity is an idea. It's a thing, but is it also a verb, a practice?
So no, it's an
Okay.
idea, it's a thing. Now there's neuroplasticity retraining.
Okay, neuroplasticity retraining.
Yes.
So if you've had chronic pain, and we may have this figure eight happening within the mind-body system, where even though the body has physically healed, the brain is sending messages to the body that are causing you to still experience pain.
Yep.
And in that situation where the brain is sending messages to the body, can that cause actual true harm? Like, can that be causing inflammation in the body that can be further perpetuating actual injury?
Yes, it can.
Wow.
Yeah. So
Whoa.
so when you have an injury, the immune system kicks in.
Yes.
It creates inflammation, and there's something called cytokines that get activated as well, and they irritate nerve sensors and they produce pain.
Yeah.
Okay. So then that signal goes up to the brain, and then the brain sends pain signals down. Now, eventually, if that tissue heals, but the brain is still sending signals down, it can continue to activate the immune system, which perpetuates inflammation and those cytokines and more pain. And then the brain is sending those pain signals down, but now because it's created an actual situation, signals of true, like danger signals that produce pain come up, and it reinforces for the brain, hey, see, there's something wrong down there.
Wow.
So I'll send more, and it's just a loop.
Let's talk about neuroplasticity retraining. What does that look like? What does that mean?
Yep. So there's different ways that we can do it.
Okay.
One piece of it that I work with clients on is actual education. So that's one piece of it. This conversation we're having, I use specific modules to educate you. Did you realize this? Bingo, they have an aha moment.
Yes.
And it's like, did you realize this? Oh my God, that sounds like me. Yes, I think about it all the time. Yes, I'm fearful. Yes, I'm worried.
Can I ask you one
Sure.
question?
Yeah.
You're educating people and bringing awareness to it. And obviously just some of the stuff that we're discussing right now, the fact that they could have pain that's not actually being caused by hurt.
Right.
Is there anything else in that often brings an aha moment that would be helpful?
Yes. So something that is very powerful is to understand the way something in your brain called the homunculus works. So in your brain, there's a representation of your entire body. Okay. And so it determines where signals are coming from and where it needs to send signals back down. So if you originally had pain on your jaw and you sent the signal to your brain, and your brain said, oh, that's coming from the jaw, that's an issue. We're going to send pain there. You would have pain on the jaw.
Yes.
Typically, as time goes on, the longer you've been in pain, the homunculus, that area of the brain, starts getting a little foggy. It starts kind of losing its way. And so it gets signals in. It's not sure where it comes from because it's been in pain for so long. And it starts sending signals to other areas, to the neck, to the chest, to the ear. And so now you start thinking everything is spreading. I'm having this spreading pain, not realizing it's because you've been in pain for so long that it's kind of like blurry and cloudy, and it's just an error on the brain's part.
No, this is not fair. This makes your job so complicated.
Yeah.
And the body is just so complex and so multifaceted. It's amazing. Okay.
Yeah.
So that is very important for people to understand and to have awareness of. So we're building awareness of how the body works and how layered it is. When we're talking about neuroplasticity retraining, what's the next step? Where do we go from here?
So once you start building a foundation of knowledge, now we want to utilize strategies. So there's different strategies that you can use. So for example, one is called graded exposure. So let's say that your neck always hurts when you turn it to the left, right? Is it a physical injury? Is it your nervous system protecting you? Is it hypersensitive, as we talked about? So one thing you can do is begin by closing your eyes and visualizing yourself moving through that range of motion totally normally, no restriction, no pain, and you go through it 10 reps of it a couple times. You do it throughout the day, maybe you do it for a couple days, and you start envisioning yourself confidently moving through the range. Now the next step would be to close the eyes and envision yourself moving through, but while actually moving. So you're really focusing on moving, you're removing the fears from the process, you're controlling the muscles, you're really focusing on your movement. And then ultimately you would begin just eyes open, normal range of motion. And so what you're doing is you're removing the fears, you're focusing on the area, you're allowing yourself to move through with control. And once you can get through it a couple times, you're able to retrain your brain that this movement really is not because of some type of physical issue in there. It's just because of all the hypersensitivity.
My mind is blown because what you just did is not complicated.
Yeah.
Like, it's not complicated. And I can only imagine some people listening right now who have had chronic pain for months, years. Now, obviously doing this type of exercise doesn't happen overnight. We actually have to change the neural pathways and the way that the messages are being sent in the brain.
Right. A lot of the stuff you can do from home.
Yeah.
And so that's one of the ways that you can do it. There's something else called pacing, where you're actually going to start breaking down the activities that are difficult for you into smaller pieces.
Okay.
So for example, we could even say, like, some people say, every time I can't do laundry anymore. Now, I would love to have that problem.
I can't do laundry anymore. Wait, is that an option?
Yeah, you have chronic pain. No.
I have very chronic pain.
So because lifting and
Yeah.
it's too much on the body. So breaking it down I just do one small load. So let me back up. There's something called intensity, duration, and frequency. I call it I don't fail. These are the three things that you can play with. So what I tell people to do is drop everything down to 50%. So 50% less intense, 50% as long, 50% as frequent.
Yes.
Find a level that you can do things at, and then build yourself back up.
So smart.
So for laundry, for example, you might do smaller loads more frequently throughout the week instead of having one big laundry day. Right. And then from there, you start seeing if you can do a little bit more. Can you carry a bigger load of laundry? And can you slowly build it back up again like that? So this would be more of a kind of an advanced one. This is where we're more connecting the neuroplasticity to the physical movements.
Yeah.
But again, that's the way you look at it, because a lot of people have these, what we call these crashing cycles, where it's like, I'm scared to do anything.
Yes.
But I finally had it, so I'm going to do it. And they do it, and it causes so much pain. And then they shy away from it and don't do it for weeks again.
Right, because the pain really is there when they're doing
Right.
these things. It is truly being experienced by them. It's not just in their head,
Right.
as some people may imagine.
Right.
It really is something that they're physically feeling. So they go to do that activity again, even if they've been doing some of the mental training that we talked about earlier.
Right.
And they're going to have to work through this. So we're breaking it down, lowering the frequency, the duration, or the intensity of it.
Right.
And working our way up, building our way up.
Yes. And
Okay.
then that way you build more confidence.
Gotcha.
You kind of want to teeter right where it's about to become uncomfortable.
Yes.
And that's how you kind of raise that threshold so you can tolerate more.
Which really is the recipe for growth in any area
Yes.
of our life if we're looking for sustainable growth rather than these huge jumps and leaps, taking things one step at a time.
Yes, absolutely.
Okay, so we've built some awareness. Then we've actually started to put things into practice to help with neuroplasticity and retraining the brain around pain. Anything else that we can do?
So there's something else called neuroplastic strengthening. So think about if you've ever gotten into the habit of eating sugary foods or cookies and cereal before bed, right? And you're like, oh, I can't keep doing this, but it's a habit. And at some point you have to break that habit, right? And because we know that that's not a good thing to do, you'll put your foot down at some point and say, all right, I really need to take a break from this.
Yes.
We place value on eating healthy, not smoking, not drinking too much alcohol. We put a value on these things. But for some reason, when it comes to just thinking about your pain,
Yes.
we're like, it's out of my control. But it really is. And I think part of the issue is because we haven't actually placed some type of negative effect on that. like we do for these other things I mentioned. But in reality, it's really making people's lives a lot more complicated. Some people are having to stop working, like relationships being disrupted.
Yes.
So for whatever reason, like a magnet, we're drawn to pain. And I think that in the beginning, it's because we want to figure it out. What's causing it? What are the patterns? And that's okay. But at some point, it does hit a point of diminishing returns. Okay. So we need to employ that same type of strategy. So neuroplastic strengthening would be taking an object, anything, even we could say like my coffee mug here.
Yes.
We imagine it, right? So you close your eyes, you think about that mug, you think about the texture, what it looks like, what it would look like to feel, and what it would feel like if you touched it. And anytime your pain starts to come in, you acknowledge it without emotions. So you say, okay, I feel that pain coming in. I don't have time to deal with this right now. I'm doing something else. I'm going to put you aside. I'll deal with you later. And so you're learning to take the emotion out of it, and you're building your resilience. So you might set a timer for 2 minutes and see if you can actually get to a point where you don't allow that pain to come in at all. And then you build up over time. And that can do two things. Number one, it builds up your willpower to not think about something you shouldn't be thinking about. But also, once you start realizing you can do that, again, it's one of those aha moments that starts opening things up for you. Like, wow, I feel so much better when I'm not thinking about it. So maybe there's more in control, more that I can control about this than I originally thought.
Beautiful.
Yeah.
It has a similar flavor to meditation where you're noticing your thoughts or you're noticing the sensations or the feelings in your body, and you're practicing almost just letting them float by or pass by without attaching to them and gripping onto them and dissecting them and, moving down that thought even more, but rather imagining the pain or the thought and just picturing attaching it to a cloud, letting it float by, or letting it, like a leaf on a stream, float down, which feels hard when you're starting to do it. It really is a practice, but with time, can literally change your entire life.
Yeah, 100%.
Right?
Yeah.
Oh,
it can change everything.
So many incredible exercises that you've shared with us today.
Yeah.
When somebody comes in to see you who is experiencing chronic pain, where do we begin? I mean, we've provided so much information, exercises that they can do. If there's just one thing that you would want somebody to hear and take away from this episode, what would that be? The
main take home is that going back to the figure 8, everything is interconnected. It's coming from the physical body and the nervous system and the mind. Whatever area of your body is having pain, there could be physical injury in there that we need to rehabilitate. And at the same time, we need to strengthen the nervous system and start healing that as well. And there's other strategies that I didn't even go into about, like, making sure when you're moving, you're activating the right muscles, and you have certain muscles relaxed and certain muscles contracted, and you know how you're moving. Because sometimes you could be on to the right path, you're doing the right exercises, but you're tightening up or contracting or not allowing that seamless flow. And so it just goes back to integrating both sides of that figure 8. All right, I could talk to you about this stuff forever, but we do have some amazing questions from our audience for our Ask Me Anything segment. Are you ready? Yeah, I'm ready. Okay. Question number 1. I have pretty chronic lower back pain that gets triggered from sitting for long periods of time, and it really flares up whenever I fly or take long drives over an hour. But lately, I'm starting to feel that exact same pain even on the way to the airport or right when I start a drive that I know is going to be a little long. Is my brain actually anticipating and creating the pain before it should happen? How do I break that cycle my brain seems to be stuck in? The anticipatory effect of pain is very real. And so here's a couple things that you can do. Number 1, just acknowledging that, like understanding I have pain when I get in the car because I really want to enjoy this trip and I'm scared that I'm not going to. Yeah. I'm very frustrated this has not gotten away. Everyone keeps telling me, like, just this is life, like whatever, you're fine, just get over it. Like, I'm frustrated in so many ways. Failed treatments can also create more frustration, different opinions from doctors. So if you can actually write down and acknowledge all of that, that alone can be very powerful. Another thing you can do is visualization before you go in the car. Imagine yourself actually going in and having a drive or being in the airport and flying without pain. Because visualization is so well researched in sports that it has an improvement on performance, and it will have the exact same effect in this capacity.
Perfect. I like what you said before as well about testing the duration or the frequency as well. Can you do a shorter drive perhaps?
Right.
And test it out, feel more confident in your ability to get through that pain-free?
Absolutely.
Okay. What is the best way I can increase my brain's plasticity?
The best way to get started is just that, to get started with education, with trying the strategies that we went through as well. There are also different foods and supplements that will support neuroplasticity better. So for example, omega-3s, which would be like fish, like salmon and sardines, antioxidants, so berries, leafy greens, which also have folate, which reduce inflammation in the brain. Eggs, nuts, and seeds, turmeric, which actually helps to increase brain-derived neurotropic factor, which is a protein, which helps promote neuroplasticity as well. So these things can all be very helpful.
Amazing. Is there an age where your brain becomes too rigid or set in its ways for meaningful neuroplasticity?
I don't believe so. There may be research out there that shows when the declines in the brain do occur, but to me that would be irrelevant and a question not even worth exploring because you have a brain and you need to make changes and you should just go and do it.
It kind of feels like one of those thoughts that you were talking about before where
Yeah.
we have that thought and then we cling to it. So
Yes.
let's just throw those ones out the window and imagine that everything's possible.
Exactly.
How long does it actually take to rewire your brain when you're trying to break a bad habit?
So I know that there's studies out there that say like, I don't even know the number, 17 times to create a habit.
Yes.
I try again not to focus on those numbers. If you really focus within 1 to 2 weeks, you can start getting that ball rolling and feel like you're making progress. And from there, it's a journey. We know that you can fall back. We know that you can have other times of progress. So in my experience, working with people for 3 to 6 months, they make significant improvements.
Amazing.
Yeah.
Thank you so much for joining us today and sharing your vast expertise with all of us.
Thank you so much. This was a pleasure.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.